This is a presentation that deals with the history of medicine in Lunenburg County, Nova Scotia during a 200-year period from its beginning of 1753 up to 1953. And it's presented by the Medical History Society of Nova Scotia. We are supported by three funding agencies. One is Doctors of Nova Scotia, another is the College of Physicians and Surgeons of Nova Scotia, and the third is the Office of the Dean of Medicine at Dalhousie. When people ask me about the history of medicine, the typical questions I get are the ones shown here. They want to know who were the medical practitioners in Lunenburg County during that 200-year period, and obviously we're not going to mention them all, but we'll highlight some of them. Where did they get their training? What training did they receive? What diagnostic methods did they use? What infectious diseases were they dealing with in the county? How did medical practitioners treat disease and illness? How was mental illness treated? And who was responsible for establishing hospitals in Lunenburg County? Well, the settlers arrive in Lunenburg from Halifax in June of 1753, and surprisingly, they're accompanied by 7 surgeons. The main surgeon was Leonard Lockman, who was educated in Germany. He came to Halifax with Cornwallis in 1749, and he stays in Lunenburg until about 1759. A number of other surgeons, John Erad from Württemberg, he came with the foreign Protestants in 1751. And he served as a surgeon in Lunenburg until he died in 1757. Ulrich Klett came on the Anne in 1750, and he also practiced as a surgeon in Lunenburg. Carl Deglin came on the Gale, 1752. Christopher Nicolay, born in Hesse, he came on the Murdoch in 1751. He appears to have been both a physician and a surgeon until 1779 in Lunenburg when he moved to Halifax. He not only was a surgeon and a physician, but he operated a school in Lunenburg. And he also practiced as a man midwife delivering babies. It was quite common at that time for physicians and surgeons to be a man midwife. They made quite a bit of money delivering babies. They were in competition, of course, with the midwives, and it was somewhat confrontational at times. He died at sea in 1800. Johann Edmund was from Hamburg and came on the Pearl, and he was a surgeon in Lunenburg in 1754. John Phillips went up to Lunenburg as a surgeon to a company of rangers. They were sent there to provide protection of the settlers from the attacking First Nations people and also from French people who really didn't want them to be there. They wanted to have the territory for themselves. He was also a man midwife until 1766 in Lunenburg. Now, in Lunenburg in the 1750s and 60s, there is evidence of a maternity hospital. There is a record in the Nova Scotia Archives collection of 14 births in the hospital. Now, all we know about it is that it had 5 cradles. We don't even know exactly where it was in Lunenburg, except it was there. The 2 midwives in Lunenburg in 1764 were Maria Mosier and Maria Tatry. They were paid £10 per year for their services. In 1766, it was reported that the midwives in Lunenburg were dead, which would indicate that both Maries either moved away or had died. Just like to highlight this Christopher Nicolay. He advertised in the Halifax newspaper in 1787. He calls himself a surgeon and a man midwife. And he's advertising that he treats smallpox, and just exactly how he was treating it, of course, we don't know, but he was treating smallpox. He says both natural and by inoculation. Natural means that a person did nothing about their smallpox at all. They didn't take any sort of inoculation. And also at that time, inoculation was taking place. They were taking smallpox material, it's called lymph, from a patient with smallpox, a very small amount of it, and injecting it into a person. They had the idea that if they did that, that it would cause them to become immune to the smallpox virus. It didn't quite work, but they tried it anyway. He charged half a guinea at that time. And he also said that he could provide nursing services and lodging in his house, and for a certain charge in Halifax. There was a smallpox epidemic in Lunenburg, a very bad one, in August to December 1775, and the reason we know something about it, the rector of St. John's Anglican Church described the epidemic in August of 1776. He says, "The settlement was visited in the fall of last year with a dreadful plague, I mean the smallpox, which had never been here since the settlement began. As soon as it was spread enough to be certain that inoculation could not be charged with further propagation of it, I gave the example and inoculated my eldest child, but this method was not relished by the generality or the general population. I dare say above 1,000 more had it in the natural way, and dreadfully too, though but few died, not above 80. It doesn't sound like a few, but he says not above 80 people died. Owing to the poor and frugal diet of the settlers their lives long, and to the robust laboring people, as also to the favorable season of the year, for it happened between the heat of summer and the beginning of winter." Now, the smallpox was all over Nova Scotia, and this graph shows the deaths in Halifax and then the deaths in Lunenburg. And that's for the period 1775 to 1776. Now, this smallpox epidemic in Nova Scotia is extremely important in the history because George Washington was prepared to invade Halifax in 1775. And he was ready to leave, and then he heard that there was smallpox had broken out in Halifax. So he decided to delay the invasion. He had an army of about 2,000 soldiers, and in Halifax at the time there were only 200 soldiers defending Halifax. So he would have been able to capture Halifax, and of course it would have been part of the United States today if he had done so. The only thing that saved Halifax and Nova Scotia from becoming part of the American or the United States at that time, and even now, was the fact that smallpox had broken out in the town and in Lunenburg. Now, some of the doctors who came later in Lunenburg, one of the most important was Dr. John Bowman, who was a surgeon, an apothecary, and a dentist. He did everything. An apothecary was, of course, a pharmacist and a dentist. We know about that. And so he was there for many years, as you can see. He was almost there for 53, 54 years. When he died, surprisingly enough, his daughters, two daughters who were single, unmarried, they were destitute. It always surprises me, but Bowman apparently didn't leave much to look after them. So they sent a letter to Queen Victoria in 1842, which I found a copy of, and it described how their father had done so much for the crown. He had been born in Saxony, came to America in 1776 during the American Revolution as a surgeon, and he was taken prisoner at the Battle of Saratoga, where he received a severe wound. And then he was part of a prisoner exchange which brought him to Halifax. In 1779, he was sent from Halifax to Lunenburg to provide medical assistance to the people there. And later on, when Lunenburg was plundered by the Americans, their father lost his property. And this is probably why his two daughters were destitute after he had died, because he had been plundered up his property and probably his personal effects by the Americans later on. Dr. John Bowman's contribution to medicine, politics, and education in Lunenburg County is quite major. In 1793, he was elected to the House of Assembly in Nova Scotia and represented the Lunenburg Township until 1809. He was appointed health officer for LaHave, Lunenburg, and Chester. He was appointed also in 1801, appointed trustee of the school at Lunenburg. And his sons, Edward and John, both attended school in Lunenburg and then both became surgeons. John Jr. qualified as a member of the Royal College of Surgeons of London and was killed in Spain in 1811 during the Napoleonic Wars. Son Edward, apprenticed to his father and studied medicine at Harvard. He then returned to Lunenburg and he practiced medicine and surgery at Lunenburg from 1825 until 1843. Dr. Godfrey Jacobs is another long-serving surgeon in Lunenburg County, 1817 to 1863, born in Halifax, trained in London at Guy's Hospital, qualified as a member of the Royal College of Surgeons of London, and then established a practice in Lunenburg. He was health officer for Lunenburg for many years. Established a board of health in Lunenburg, and his three sons all studied medicine and then later practiced in Nova Scotia: Henry, Stanage, and Thomas. Dr. William Slocum was a physician surgeon in Bridgewater in Lunenburg County from 1839 to 1865. He was a graduate of Bowdoin College in Maine and did postgraduate studies in London and established a practice at Bridgewater. He invented the Slocum pulmonary waste belt to treat consumption or tuberculosis. I doubt if it had any effect whatsoever, positive effect, because tuberculosis was a bacterial disease, and wearing a waist belt is probably not going to really do anything for you. He also used electrotherapy to treat diseases and neuromuscular paralysis. Now that actually did work to some extent because it exercised your muscles and caused blood to flow to the area where there was some sort of a problem, disease or otherwise. He was also a proponent of the use of mesmerism to treat disease and illness, which was quite prominent, quite common at that time, the whole idea of using mesmerism. Now at that time, there was quite a problem with the way they treated people when they were treating them. It was called allopathic medicine. Allopathic means all diseases were treated exactly the same way. And the way they were treated was that they gave cathartics to evacuate the contents of your bowels, of your intestines. They gave emetics to induce vomiting so that they could remove everything in your stomach, and diuretics to remove what was in your urinary bladder, and then they would bloodlet. They would actually make an incision in a vein and just let the blood ooze out until you had about half of the blood that you normally would have in your body. Now you could imagine that this was a very, very difficult situation for the patient because it meant that everything out of their intestines, their stomach, and their urinary bladder was removed, and half their blood was taken away. So they were absolutely without any energy at all. And some people actually did die because of the way that they were treated in this method. It was called depletive therapy because they were depleting, various items in the body. And also it was called heroic therapy because it was heroic that the patients actually did survive. After they did that heroic or allopathic treatment, they would then build up the patient with various stimulants and hope that they would survive. The idea was that if they could get rid of all the contents of these chambers in the body, that would mean that the disease would have been removed from the body at the same time. They had no idea what disease was at the time. There were alternative methods to allopathic, and here's a list of them. Thomsonian, botanic, hydropathic, mesmerism, homeopathic, and electrotherapy. Now, of these, the only ones that probably did anything useful were botanic, where they were using a lot of herbs, and some of the herbs, of course, were produced by the First Nations people and were quite effective. They came mainly from barks of trees and from roots of various bushes and so on. The electrotherapy was quite effective because it stimulated muscles. The one that really was criticized a lot was the homeopathic. The homeopathic was based on the belief that you could take a very, 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 very small ingredient from a medicine, dilute it 1,000 times in water, and then give it to the patient. And for some reason, they believed that might actually cure whatever the patient was suffering from. It really was almost what you'd call nihilism. Nihilism means that you really don't do anything for the patient at all, and it's sort of the placebo effect of treating a patient, where the patient psychologically thinks they're being treated, and somehow they survive. It was very much frowned on by sort of allopathic medical practitioners. At that time, there was very, very little diagnostic procedures that were followed. We don't get any major diagnostic devices until earliest is 1816, when we have the stethoscope to measure, of course, sounds from the chest and from the heart. It didn't catch on very fast because it took quite a while for a medical doctor to understand what they were listening to when they listened through a stethoscope. Because the stethoscope, the sounds emanate from a stethoscope sound like a sort of noise, and it takes a mentor or a senior doctor who's very familiar with it to be able to teach a student as to what they're listening to and what sound represents, say, the opening of a valve or the closing of a valve or whatever. So it didn't catch on very fast. It was really up in, almost in the 1840s before the stethoscope became a useful device. The other thing, of course, was the microscope, which came along eventually, and it became very commonly used once Louis Pasteur showed that it had great opportunities for detecting things like different types of bacteria. Then the ophthalmoscope, which came along to look at disorders of the eyes, 1851. Surprisingly, the thermometer doesn't come along, the clinical thermometer doesn't come along until almost 1870. It's really surprising that it took that long, because the thermometer had been around for years. Centuries before that, but it was never adopted by the clinicians until 1869. Before that, they would simply touch the forehead or the skin of a patient and judge whether they had a high temperature or not. But the thermometer, of course, meant that they now knew what the temperature of the body, of the internal areas of the body was. Another major advance, of course, was a sphygmomanometer to measure pressure, to measure blood pressure in arteries. That didn't come in until 1881, and then, of course, we get the X-ray in 1895, the electrocardiogram in 1896, and finally, blood grouping. Before that, they had no idea that different patients had a different blood type. They just treated all blood types the same, and in 1901 it was shown that different people have different types of blood type. At about 1867, we have a major development in that Louis Pasteur recognizes and announces that there's really microorganisms that exist, and they can infect surgical wounds, and they're in the air. So that if you have an open wound after an operation, microorganisms are, so to speak, landing on the open surgical wound and infecting it. So Dr. Joseph Lister at Glasgow University, he came up with an antiseptic procedure for preventing these microorganisms from creating suppuration and putrefaction in wounds. In other words, pus formation in wounds. And however, his ideas were rejected by leading physiologists, surgeons, and medical practitioners in both England, France, and the United States. It took him 10 years to convince the surgeons in London that in fact antiseptic surgery was what you should be doing in order to reduce infection. Just an example of how much infection was involved. Before Lister introduced this antiseptic procedure in his ward at the hospital, 40% of his patients who had undergone surgery for a compound fracture, for instance, died from infection. Once he introduced the antiseptic surgical method, the percentage of people who died in his ward after surgery went down to 2%. So it was a dramatic development that he made, and one of the two most dramatic developments of the 19th century, one of them is the introduction of anesthesia, chloroform, and the second is the introduction of antiseptic surgery by Lister. Now, there were a lot of infectious diseases that were current at that time. Bacterial diseases, cholera, consumption, diphtheria, scarlet fever, trachoma, typhoid fever, and whooping cough were the ones that were most common and were killing hundreds, thousands of people. So a number of scientists, medical scientists, particularly in France and Germany, started to try to figure out what was causing these diseases. So in 1880, for instance, Louis Pasteur discovered the bacteria called bacillus for streptococcus, for pneumonia. And in 1882, Robert Koch in Germany, he identifies the bacteria that causes tuberculosis. And in 1883, Klebs in Germany discovers the bacillus for diphtheria. And so you see what's happening during that period. There's a tremendous amount of activity by medical scientists trying to discover what these different types of bacteria. Now, that didn't really help a great deal, because after they discovered the bacteria, the next thing they had to do was how are you going to kill the bacteria, because that's necessary if you're going to eradicate it. And there's some others. There's also, of course, viral diseases, measles, smallpox, and yellow fever. Of course, smallpox was eradicated, or at least it got a vaccination procedure introduced by Edward Jenner in 1796, and it of course saved many lives. A later physician, and the first woman physician in Lunenburg County, was Dr. Victoria Ernst. And she came there in the year 1900 and practiced for 30 years. She was a graduate of Dalhousie. In fact, she was first in her class in 1900. She specialized in providing medical attendance to women and children. And she never married, and she acquired a great deal of real estate. And when she died, she left a great deal of money to various organizations, mainly organizations who were in poverty, and to the people in Bridgewater and in Lunenburg County. Dr. Wallace Rafus was in Bridgewater from 1903 to 39, a graduate of McGill, did postgraduate training at the Mayo Clinic, one of the first. Largely responsible for the establishment of the Dawson Hospital in Bridgewater in 1920, and chair of the Hospital Board of Management. He became president of the Board of Trade, mayor of Bridgewater, and member of the legislature for Lunenburg County, so he was pretty involved. Frank Davis, a physician surgeon in Bridgewater for a few years before he entered politics. He was a graduate of Dal in 1911, practiced at Petit Riviere in Lunenburg County, and then in Bridgewater, and mayor of Bridgewater in 1930 to 34. He was a physician surgeon at Bridgewater from 1919 to 1934. He was a hero of the Moose River mine disaster in 1936, and also Minister of Health for Nova Scotia For 1933 to 1948, he was the longest-serving Minister of Health in the province. He did a lot for Nova Scotia, and he hasn't really been properly recognized, I don't think. Here are some of his achievements while he was Minister of Health and Public Welfare. He improved the Children's Aid Society, assisted in the establishment of the Maritime School of Social Work, promoted the enactment of the old age pension in 1933, introduced Family Allowance Program in 1945, and assisted in the establishment of the Nova Scotia School for Boys in Shelburne in 1947. He also established the position of traveling TB diagnostician, provided financial support for physicians and surgeons to take postgraduate training in public health. Dr. Chester Stewart, who was the Dean of Medicine here when I came on the faculty, actually was a recipient of a grant to take up the graduate training in public health at Johns Hopkins through this program. He introduced a dental hygiene program, established the infantile paralysis clinic, established a division of physical education, established a division of industrial hygiene, established a division of neuropsychiatry, and planned and implemented the construction of the VG Hospital, which opened in 1948. So it's quite obvious he was a busy man. Now, there were a lot of hospitals established in Lunenburg County. The first one was established by the federal government. It was called a Marine Hospital in Lunenburg, 1879. The federal government established marine hospitals all over the east coast of Canada. There was one in Lunenburg, one in Pictou, one in Sydney, one in Digby, one in Yarmouth. They were all over, wherever there were large seaports, there was a hospital for mariners and fishermen, and those were called marine hospitals. The next hospital is a hospital in Day Spring, that's on the LaHave River, and it was called the Lunenburg County Poor Farm and Mental Hospital. In other words, they combined a hospital for the paupers, the poor people of Lunenburg County, and also they had people who required some treatment because of mental condition. Then, because there was no other hospital in Lunenburg County for just the ordinary person, two nurses came along and established hospitals. Christy Maxner established a cottage hospital in a house, and Carrie Fritz, who was a nurse, she established another cottage hospital in a house in Lunenburg in 1910. Then along came a major step in 1920. The Dawson family of Bridgewater promoted the idea that there really should be a general hospital in Bridgewater. Bridgewater was getting to be quite a large place at that time. So they donated $20,000, and only if the people of Bridgewater would come up with another $20,000, and with the $40,000 that the hospital could be built. So that took place in 1920. Now, Lunenburg town, surprisingly enough, didn't have a general hospital until 1952. We have the opening then of the Fishermen's Memorial Hospital. So the Marine Hospital I mentioned earlier, established in 1879, erected by the federal government, 12 beds, served as a quarantine station and treatment hospital for sailors and fishermen. And then during the Second World War, Norwegians occupied the hospital because, remember, Norway was overtaken by Germany during the Second World War, and the Norwegian sailors who were out at sea when Norway was taken over by the Germans had no place to go. So they ended up in Lunenburg and were housed in this hospital. It closed in 1953. The Poor Farm and Asylum at Day Spring opened in 1889. It was on land donated by the leading businessman in Bridgewater, Edward Davison. It accommodated 28 paupers at the beginning. There were no fire escapes, it was heated with coal, very poor water supply, and in 1917 they added a wing to look after mental patients. In 1929, there were 35 poor people and 81 what were referred to as harmless insane in the establishment. Harmless insane were people who in fact had dementia, or what we now call Alzheimer's, and they really would not attack anyone, and they couldn't be cured, so they were called the harmless insane. The insane people who were possibly treatable would be sent to the Nova Scotia hospital. It didn't close until 1980, which a lot of people are surprised at. Here are the hospitals created by the nurses. Christy Maxner and her house, nice little house in Lunenburg, and Carrie Fritz, another house just outside of Lunenburg. It was quite a job to find these photographs because I had to go to Lunenburg and talk to a lot of people before we could actually locate the photographs. Then the Dawson Memorial Hospital came from the estate of J. Kenneth Dawson. It contained 27 beds, including 5 for maternity. I think that Dr. Rayfuse, of course, had a very, very important role to play. He performed the first operation in that hospital. And the X-ray machine was given by William Duff, the Member of Parliament for Lunenburg, Queens. The Fishermen's Memorial Hospital, 1952, you see it's in the picture there. It's sort of a more modern-looking hospital than the others. 35 beds and a nursery. They planned to build the hospital back in the 30s, 1934, but they didn't have the funds to build it, so it was abandoned. And it wasn't resurfaced again or started again until after the Second World War. So fortunately, they were able to build it. So that's the end of the story of the history of medicine in Lunenburg County, and thank you.